Today's class we will see about organizing College of Nursing. The question may be asked you as a principal, how will you organize a College of Nursing? You can imagine that any one person, even though he is the very richest person, he want to open up a new college, or he want to organize. He is only have a money. The nursing personnel having the knowledge with the INC guidelines, we have to open up and help that person to open up the college, or you yourself want to open up the new college. What is the protocol and criteria? Easy way thing you have to remember is the prerequisite of the opening of new college. You have to remember, any opening new college, you should formulate the board of management. Who will be there? You have to conduct board of members and management who are will be there. Mostly all the colleges are open up in the name of a trust. Okay, then formulate the philosophy of the college. Philosophy of the college I have discussed in the curriculum, how to develop the philosophy. I accept, I believe, I recognize. These three words can help you to make the philosophy. Okay, then we have to get this permission from the state government. Is it the Tamil Nadu or West Bengal or Andhra, Kerala? That you have to get the permission. Where the building should be, the land permission also have to get the approved land. Where the land should be, it should not be in a residential area, it should be little bit away from the area, and then land supposed to be belong to the name of the college or the owner who is going to have this law, or it should be in the trust name. At least it should be in the name of the trust. If you don't have the own land, you cannot open up the college. No, there is a INC guideline saying that you can have the lease deed, nearly 30 years lease deed. You can take it. You can see some of the time, you see it's all upside down. Like if you take the engineering, I have seen many engineering colleges being converted into nursing college building. Okay, so sometimes upside downs will be there, engineering down. So those owners would like to set up the open up the nursing colleges. So as a person, how you will open up? So you have to ask them where is the land deed, but then you have to change the land deeds, and then square feet, everything we will see. To open up the college, how many acres of land is necessary, what is the square feet, how many people will see that. Then permission from the state nursing council. Okay, after all these things, you have to submit it to the state nursing council, and those people will be coming and for the inspection, and they will conduct it. And then with this you can apply for the INC affiliation, and the university also will be coming for the inspection if you fulfill the INC criteria. In this class we will see. And now the criteria, INC criteria, clearly saying that if you want to open up the new college, you must possess at least 100-bedded own hospital. The 100-bedded own hospital is the parent hospital. This parent hospital should be in the same trust name, and also permission letter should be granted, will be submitted to them. Understand? So after getting the state government permission and other things and all, because parent hospital alone is not going to enough to satisfy experience for giving experience for the students. You also has to get primary healthcare permission where the deliveries will be happening. So the hospital, primary healthcare center, all the permission letter has to be collected from this one. Okay, so these are all the prerequisites you have to remember. First you have to buy the land for that, and then permission from the state government, and then lease. If the land is not owned, it should be in the lease name of the trust. Permission also should be granted from the state and state nursing council and university and INC, and it should be a 100-bedded own hospital should be there. If not own hospital, you have to make a memorandum of understanding with the hospital owners and make one MOU, and the permission letter also should be granted, and there should be a tie-up. You have to make it. Legal tie-up has to be made it. So the easy way to remember how to organize a college of nursing, though INC guidelines are there, with this all the prerequisites keep in your mind. And then another thing you have to keep in your mind is man, money and material. So the man, material and money, what does man? So if you want to open up the college, you have to follow the criteria. A simple thing, you have to follow the INC criteria. It's giving a superb guidelines. They are telling first you need the students. So admission criteria they put up, what is the students where they have to study pass, they must be passed from the 12th standard, 45 mark in the physics, chemistry and biology, and should be from the recognized schools, and medically the student should be fit, and admission in a BSc program is only once in a year happening. And then follow the reservation policy. For example, if you take some government college cannot provide the population ratio with a government college is not matching, so the government quota will be allotted by the government, so you have to recruit 40% government quota, then 60% you can take. You have to follow the policy, either the whatever the state government is telling, you must follow. Then the teaching faculty. The teaching faculties, you have to draw the organogram, and the teaching faculty you must have, we are talking about first, any colleges with this, even a 200 bedded hospital also there, first they will give permission for the 40 to 60 intake only. Then you have to apply for the another inspection to upgrade that. If you see, first the principal, one principal, she must have possessed the MSc 15-year experience, minimum 10-year teaching experience after her MSc program. PhD is desirable. Vice principal, MSc with 12-year experience. She also must possess the 10-year of the teaching experience after her MSc program. Professor 1 must have the same experience, like a 12-year experience, and this one. Associate professor must be having 8-year experience after MSc, and in that 8-year, 5-year must be a teaching experience should be having after MSc. Assistant professor, MSc with a 3-year of experience, and tutor will be 8 to, desirably they are telling, even the tutor with the MSc preferably they are choosing, 8 to 16 tutors will be available. They are with the 1-year experience, either the BSc, BSc or the post basic BSc, 1-year experience they should possess. Then additional staff members in the college. So these are all the teaching members, and also will have a non-teaching staff members will be there according to the subjects, doctors and other people, nutrition, biochemistry. So some experts will be coming and taking. What they are telling, the additional external faculty are taking. The nursing faculty must share. Nutrition is 50-60 hours. 30 hour can be given to the external teacher, and 30 hour can be nursing fraternity has to share the subject. Anatomy is 100 hour. You can give only 50 hours to others, and 50 hour nursing fraternity has to share that hour. That is the criteria. Then additional staff in nursing, ministerial staff. There is administrative officer AO 1, and office superintendent and PA to the principal, and accountant or the cashier 1, upper division clerk 2, lower division clerk 2, storekeeper 1, classroom attendants 2, librarian 2, sanitary staff as per request. Some big building or something you can have not only 2 or 3 or 4 you can have. Pune must be having 4, and warden should be 3. Cook as per your requirement you can keep. No hard and fast rules in that. Then also should follow the college management committee. That following member: principal will be the chairperson, vice principal, professors and nursing superintendent, and representative from the medical superintendent. So this college committee can be formulated. If that college having a various courses, like example PhD or some of the programs or MSc programs are there, they can formulate the ethical committee also. In that ethical committee, you can have a lawyer, you can have a teacher, you can have one public, you can have one advocate and one doctor. So all the professional must be there in the ethical committee. This is only for the BSc nursing for the 40 to 60 intake. Then I should have all the records should be ready. How many records? An anti-ragging committee and other committees. What is other committee? Like SNA committees. You have to formulate the SNA protocol, and many disciplinary committee, library committee, a recreation committee. So there are 10 committees are coming under the Student Nursing Association committee. SNA committee has to be organized and should be well planned. So that is about the man. So what are all the, from the teaching staff to non-teaching staff and the additional management committee. And then about the material. Material will be a movable material and non-movable material. As I told you, the material like one building, it should be the building. If that management having 2-3 courses, B.Ed, DLED or any other courses or other, nursing should have a separate building. That is the main criteria. They are telling nursing should have a separate building, and they are clearly stating about the various lecture halls. 4-year program, right? So 4-year, 900 square feet. So it is about the 3,600 square feet, and the nursing foundation lab can be combined with the adult health nursing lab. So no need to separate medical surgical lab. It should be in a both, but the square feet is 1,600. Community nutrition lab can be combined. So it is 1,200 square feet. About OBG 900 square feet, child health nursing 900 square feet, pediatric and the preclinical science lab will be 900 square feet. You can have anatomy lab also can be, computer lab will be 1,500 square feet, AV rooms with all equipments. AV room like all the AV so you can have a microphone and about the OHP, about the tape recorder, radio, any AV has to be placed. And multi-purpose hall will be 3,000 square feet because nursing should conduct various programs, various days. Will be common room should be there 1,000 square feet. Staff room should be 800 square feet. Principal room 300, vice principal 200 square feet, and library will be 2,300 square feet. And HOD's room 5 HODs into 2,000 square feet. Faculty room will be 2,400 square feet. And then provisions and other toilet and other things will be 1,000 square feet. So totally if you see 23,200 square feet. And this program and also must have a hostel. Mostly INC is recommending should be all the students must be stay in a hostel unless until their houses are very nearby. So it will be a single or double bedroom or whatever it may be. That will be 12,000 square feet. And they were talking about 5 students per 1 toilet. So that they will be counting 600 into 4. So 2,400 square feet. Visitors room must be there in the hostel. So anybody coming cannot enter into the room. So 500 square feet. Reading room should be 250 square feet. Recreation room 500 square feet. Dining hall 3,000 square feet. So all the students can shift wise can have their food, and kitchen and storerooms will be 1,500. Warden room should be 450 square feet. So total is 21,100 square feet. If you see nearly 44,300 square feet it is coming, nearly 44 to 45,000 square feet. Every lab should have adequate articles. And if you take a library is an important part, they should have a good software and online journal accessibility should be there, and every departmental journal should be at least 5 copies, and back copies also this should be there. Adequate space should be there, and reference should be in a separate books. Nearly 3,000 to 4,000 books should be minimum while you are starting up the college. Then the book number has to be increased when the years are increasing. That is about the material, the equipments and other material from all the labs. There is a minimal lab, what all the equipments should be available. Also you can take it from the INC guidelines, what all is there. You can take what is the adequate amount, and the bags, community bag, all these will be checked by this one. Outdated, for example, fundamental lab, Nelson's inhaler or the syringe heating, this one and all, it is outdated. If you take OBG, pediatric lab, Gradle, now we are talking about Gangaru care, rooming in practice, so Gradle and all should be removed it off. And and about the community, you can remove the heating, Benedict solution heating, all you can replace with the modern procedure, that is acceptable. So when the trends are increasing, that when the trends are changing, trends are coming, you have to implement. So old articles can be removed it, and adequate supply of the articles should be there. Bed sheets and dummies, fundamental lab, all kind of dummy, especially CPR dummy should be 3 to 4. CPR dummy is a mandatory for fundamental lab, and adult health nursing should be the simulation dummy is very important. So this is about the material, movable material and non-movable building material, and should have their own bus. the drivers will be the drivers name should be there in the data, should be in the principal office, and the driver's license, heavy vehicle license should be there, and that FC RC book and all should be in a good condition. The buses should be in a good condition. So we have to that will be the budget. So man and money and material. Money, what is money? So the money budget we have to make for the College of Nursing. What is the income, revenue and expenditure is the budget. Moreover, extra 4 to 5 crores of the money must be deposited in the name of the college name. So anything layoff or anything, any things are happening like a COVID like a situation or some situation we are closing the college, you have to priorly 2 or 3 month notice you have to give it to the employees. So for that purpose you have to deposit some amount of the money in the bank. So once the question is coming, ask the principal of a College of Nursing, how will you organize the College of Nursing, or anyone asking you to open the new College of Nursing, first you have to remember the prerequisite, formulate the board of member and formulate the philosophy. Next you have to buy the land and land deed, where your selection of land should be in separate building, it should be away from the residential area, and MOD like approval should be there, it should be approved land, it should not be from some other land, it's a own building or lease, you have to decide it and get permission from the state government, proceed with the state nursing council, then university inspection, then INC affiliation, and you must show the now the current important 100 bedded own hospital. If you do not have own hospital, parent hospital must be, it's according to INC rules. If not there, you have to tie up with the parent hospital, make a memorandum of understanding and get the permission letter, submit it and send it to the INC for the inspection. So this is how you have to, and then when the INC inspectors are coming, they will be checking where is the principal's experience certificate, where is their appointment order, from the driver, means it is a license, everything will be checked it, and they will see the infrastructure and everything, then the permission will be granted to open up the new college. Thank you. The one more thing is, while submitting all this detail, you have to make the master rotation plan, cumulative master rotation plan. For this 40 to 60 students intake, which include the master rotation plan, include the 4 years. For example, 2025 they are entering until 2029 when they go out. The 4-year master rotation plan will be help you to make a guiding you to make the clinical rotation plan. From the clinical rotation plan and within the master rotation plan, you have to make a timetable with the combine that correlation chart and the timetable. Correlation chart no need to submit it to them, but with the correlate that you can make the timetable, and the timetable also mentioning all the external faculty and internal faculty and the name of the teachers and professors has to be mentioned, and copy of it has to be submitted into the INC portal when you are getting INC affiliation. So every detail has to be, they will be must have to upload it. So in this clinical rotation plan, when you are making, you have to include the parent hospital. You have to show the posting the students in the parent hospital as well as in the government hospital, whomever, wherever you got a permission. For example, community, it should be urban and the rural. And also they are telling that the criteria for selection should not be the hospital, at least within 30 kilometers it should be your hospital and the community should be within 5 to 6 kilometers from your college permissions. So urban and rural permission has to be, you must get it. So with that timetable also you have to submit it to them. So that will be clearly will be telling, it's like a blueprint where the students will be going, how the blueprint of running status of the college. So that you have to program, running status of the program, which include the course plan, unit plan and lesson plan with the help of MRP, CRP, course plan, unit plan, lesson plan has to be a model copy, has to be submitted, as well as with the timetable, clear timetable, and it is up to the 4-year you have to submit it for the particular students. And the INC inspection, every 3 years INC will be conducting the inspection. If at all you want to upgrade from the 40 to 60 seat to the 100 seats, again you have to call for the INC inspection. I want to open up one more post basic BSc program, again INC will be coming for the inspection for that. In that time you have to modify little number of the same criteria will be there. The lab and all will be, you know, no need to have extra labs for that, but the classrooms and will be included, and the hostel square feet will be little bit increased. So that changes will be upgraded, that where you are having that one. Now currently INC inspectors are coming, and the current photo also has been taken, and the photos also report immediately. The report will be go within 24 hours of within the inspection. So it is mandatory to follow the INC rules and regulations to open up the new college. Thank you.